I do not make enough money to pay for health care. I'm also coming up on 30 months sobriety, and if it wasn't for the health care, for the therapy that Medicaid takes care of, I would not be as far along as I am now.
Last year, I was pregnant with my third child, and during the course of my pregnancy, my doctor told me that there is a possibility that I may have problems with my heart. If I did not have Medicaid at the time of my diagnosis, I do not know where I would be now.
I live on Social Security disability due to an accident I had while I was unloading my semi-truck. 1,800 pounds of steel was dropped on top of me and left me dead at the scene. I now have a medical condition in my back which is inoperable, so I do live on massive pain medications just to function on a daily basis.
Growing up, my mother was a social worker, and one of the jobs she had here in Atlanta was assisting women from welfare to work. So I learned really early on how important it was that there is a social safety net.
This is the closest that we have come to repealing Obamacare. And now we are sending that repeal to the president's desk.
To President Donald Trump and to the Republicans in Congress, hands off. This is not a game. This is my future. This is our children's future.
It's a moral outrage that our people should have to beg for health care.
We expect you to fix this, and we need to put people and not profits first.
I just wanted to be about really creating change, changing systems, and it be led by those directly impacted by it.
And really trying to bring a cultural shift to what it means to care for people in our community.
Unfortunately, disproportionately, people of color and moms are affected. That's why, we advocate for moms to become the leaders so that they can, one, dismantle the internalized racism that's keeping them in a cycle of believing that they deserve what they're getting, and then, after that, educating their neighbors and the community at large that we're all impacted by this.
Today we're joining people across the country in organizing a day of action.
Really proud of the role that we play to have people just directly share their stories with Susan Collins. Folks that were directly affected went to her offices, told her staff about their personal stories, but also were able to hand over just hundreds of letters every time they went in from people all across the state that we collected.
And in this odd state of politics where defending the healthcare of 22 million people requires courage, it should just be common sense, and it should just be showing her humanity.
We fought this fight with so many people across the nation, and we were empowered. We were not only empowered, we were inspired. And we continue that fight today.
You're here on this kind of rainy afternoon. You're here stepping in. I want to lift up the idea of the relentlessness of folks, the consistency of individuals who week after week are showing up. They're bringing their sides and they're sharing their voices.
And it was all those stories. All the people in this area that are on Medicaid, Medicare, Social Security, and ultimately, the legislation went down.
We don't have the votes. Am I disappointed? Absolutely.
We stopped them, and just as importantly, we built power along the way, and now our work on the Safety Net Defense Program build an army of grassroots volunteers and activists that won't back down.
And so I encourage each and every one of you as we go through the year 2018, let us not be weary in well-doing, but let us mount up with wings as an eagle and allow the storms of this fight to carry us as we embrace what Maya Angelou said. In 2018, we declare and we decree, still we rise.